America's main foundation is liberty and freedom. Liberty is defined as freedom from external or foreign rule, independence. This is how America lives our this is how American lives are lived and how we have the right to choose how we want to live them. Freedom gives us the right to an affordable life that other countries all over the world do not have. Michael D. Tanner wrote, quote, supporters of a government-run national health care system often urge the United States to learn from the experience of other countries, and they are right. But those lessons may not be exactly what the political left expects. For example, universal health insurance does not necessarily mean universal access to health care. In practice, many countries promise universal coverage but ration care or have extremely long waiting lists for treatment. Those countries that have single payer systems or systems heavily weighted toward government control are the most likely to face waiting lists, rationing, restrictions on the choice of physician, and other barriers to care. The Affirmative Constructive Debate quotes, the United States is an example to the rest of the world through power, unity, and equality. Offering universal health care provides greater equality, decreased health care costs, and would stimulate economy, end quote. The negative response is, where is the talk about liberty or freedom? Power, unity, and equality are all the essentials to our rights as human beings, but what about our rights as Americans? We need to realize we are stronger than most countries, and by allowing universal health care, it will show weakness from the bottom up. Those countries with national health care systems that work better, such as France, the Netherlands, and Switzerland, are successful to the degree that they incorporate market mechanisms such as competition, cost consciousness, market prices, and consumer choice, and exercise centralized government control. In France, for example, co-payments run between 10 and 40%, and physicians can bill over and above government reimbursement rates, something not allowed in the United States Medicare program. On average, French patients pay roughly as much out of pocket as do Americans. The Swiss government pays a smaller percentage of health care spending than does the U.S. Affirmative states from procon.org argues that the right to universal health care is implied in the beginning. In the preamble, citizens are guaranteed the right to live, which would include the health care that preserves that life. It also aims to promote the general welfare, which includes the preservation of life. She went on to say, if health care is a right to all human beings, why do we treat it like such a privilege? The negative to why we treat it like a privilege from procon.org would be that health care should not be a right because it is inconsistent with the Declaration of Independence, which guarantees the right to pursue happiness, not the right to happiness to free medical services. Healthcare should not consider a right because it is not listed in the Bill of Rights in the U.S. Constitution. The Bill of Rights lists people's rights that the government cannot infringe upon, but does not list services or material goods that the government must ensure for the people. It is the individual's responsibility, not that of the governments, to ensure personal health. Disease and health problems such as obesity, cancer, stroke, and diabetes can often be prevented by individuals choosing to live healthier lifestyles. No one should be entitled to health care because it is a service and a material good that a person must pay for to obtain. She went on to argue that universal health care provides greater equality to all citizens. Politics.org states that, quote, 45 million Americans do not have health insurance. Americans avoid getting health insurance because it is expensive, end quote. Universal health care would make health care affordable for everyone, including those who are disadvantaged economically. In 2000, 69% of employers offered health insurance to its employees. In 2005, only 60% offered health insurance to employees. Employers cannot keep up with the expensive cost of health insurance. Not only would universal health care decrease healthcare costs, but it would also decrease the overall cost of several government-funded programs, such as Medicare and Social Security. U.S. responds on the principles of equality, not the principles of individualism. Healthcare would help stimulate the economy as well. Most important aspect of our healthcare economy is our consumers and producers. Without them, we have no economy. With Association states, with universal health care, you can keep them healthier and living longer. American Medical Student Association states that the cost of bad health and lives of Americans suffering from having no insurance amounts to $65 billion to $130 billion annually. With universal health care, we could watch these costs decrease. With our current health care, many people are locked into a job that they may not care for just to have the health insurance that comes along with it. Her last part to the affirmative constructive debate is about how economy also gets infected by this due to global competitiveness. The high cost of healthcare has to be funded from somewhere. A big concern with healthcare comes from the individuals who have this mindset. Why should I be required to pay for insurance that I do not need? I won't get a chronic illness. I'll be just fine. People should have health insurance for the same reasons they have car insurance. It protects them from when the unseen happens. Lastly, the American Medical Student Association makes the case for universal health care in the regards that it contributes to the American dream. This relieves family stress. It makes it easier for families to afford the health care. Lastly, quote, it reflects our ideas of equality, economic efficiency, and all the ideas of the U.S. Constitution, end quote. The negative debate that I have towards her affirmative is from healthcareprocon.org. Guaranteeing everyone health care will lead to longer wait times for patients to receive diagnosis and treatment of illness, as in the case in Canada and the UK, potentially denying patients with chronic diseases timely medical care. Providing a right to health care is socialism and is bad for economic productivity. Socialized medicine is comparable to food stamps, housing subsidies, and welfare, all of which is charity. Distributing charity to society makes people lazy, decreases the incentive for people to strive for excellence, and inhibits productivity. A right to health care is unadministrable because it is ambiguous what kind of treatment and services should be guaranteed. Guaranteeing health care as a right will lead to an increase in demand for health care that will decrease the equality of care because health care professionals will be overstretched. History has shown that guaranteeing health care as a right would lead to greater government deficits every time the government intervenes in health care, such as with Medicare and Medicaid. There is a greater redistribution of wealth and greater government spending. If health care is considered a right, then government bureaucrats will be making health, life, and death decisions that should be up to the patient and doctor to decide. Allowing health care coverage to be driven by the free market without government intervention increases competition and the incentive for providing higher equality medical technology and service. Providing health care to everyone is a huge expense and may result in tax increases, thereby further harming the economy and individual pocketbooks. Guaranteeing health care for all Americans will lead to a problem known as moral hazard, meaning that people will take riskier actions because they know that if they get hurt, they are guaranteed. Rising healthcare spending is not a uniquely American phenomenon. While other countries spend considerably less than the U.S. on health, are both as a percentage of the GDP and per capita. It is often because they begin with a lower base of expenditures, but their costs are still rising, leading to budget deficits, tax increases, and or benefit cuts. In 2004, the last year for which data is available, the average annual increase for per capita health spending in European countries was 5.55%, only slightly lower than the United States 6.21%. As the Wall Street Journal notes, Europeans face steeper medical bills in the future, and their cash cash-strapped governments. In short, there is no free lunch. While no country with universal coverage is contemplating abandoning a universal system, the broad and growing trend in countries with national health care systems is to move away from centralized government control and to introduce more market-oriented features. As Richard Salmon and Joseph Figures of the World Health Organization put, quote, the presumption of public primary is being recessed. Thus, even at the U.S. debates adopting a government-run system, countries with those systems are debating how to make their systems look more like the U.S., end quote. Looking at other countries and their experiences then can provide guidance to Americans as we debate how to reform our healthcare system. In most cases, national healthcare systems have successfully expanded insurance coverage to the vast majority, if not quite all, of the population. But they have not solved the universal and seemingly irresistible problem of rising healthcare costs. In many cases, attempts to control costs through governmental flat have led to problems with access to care, either delays in receiving care or outright rationing. In wrestling with the dilemma, many countries are losing government controls and injecting market mechanisms, particularly cost sharing by patients, market pricing of goods and services, and increased competition among insurers and providers. Moreover, the growth of the government share of healthcare spending, which had increased steadily from the end of the World War II until the mid-1980s, has stopped, and in many countries the private share has begun to increase, in some cases substantially. There is even evidence of a growing shift from public to private provisions of healthcare. If the trend in the U.S. over the last several years has been toward more of European-style system, the trend in Europe is toward a system that looks more like the U.S. Therefore, if there is a lesson which U.S. policymakers can take from national healthcare systems around the world, it is not to follow the road to government-run national healthcare, but to increase consumer incentives and control.